name is Audrey Driskill, and I'm a family nurse practitioner. I'm also a Doctor of Nursing practice student at Duke University. Today I'd like to talk to you a little bit about the important and needed changes to our current legislation in the United States regarding financial support of abstinence-only sex education programs. First, let's take a look at the facts. Current legislation in the United States awards grants that support abstinence-only education programs. Since 1982, the U.S. federal government has spent over $1.75 million on abstinence-only until marriage sex education. These programs do not teach teens about how to prevent pregnancy or how to avoid getting sexually transmitted diseases. They only focus on telling teens to not have sex. A federal report in 2007 showed that abstinence-only programs had no impact on rates of sexual abstinence. This means that despite abstinence-only education, teens are still having sex, and our country's statistics are reflecting the consequences. Adolescents between the ages of 15 and 24 account for 50% of the 20 million new sexually transmitted diseases that occur each year. The U.S. has the highest rates of teen pregnancy in the developed world. Figures from 2009 show 39 births per 1,000 girls between the ages of 15 and 19. Our numbers are on par with Romania, Turkey, and Bulgaria. Other developed nations do a much better job than the U.S. The UK has 24 births per 1,000 girls ages 15 to 24, Ireland 16 per 1,000, France 7 per 1,000, Italy 5 per 1,000, and Canada 13 per 1,000. So why are teen pregnancy rates higher in the U.S. than all these other countries? Other countries are more realistic about teen sexuality and have increased teen access to birth control. A study at the University of Seattle found that teenagers who received comprehensive sex education were 60% less likely to get pregnant or to get someone pregnant. Compare that with the data I mentioned earlier, where abstinence-only education had zero impact on teen sexual activity. The U.S. state with the highest teen pregnancy rate is Mississippi. Their teen birth rate is 55 births per 1,000 girls. Mississippi does not require sex education, but when it is taught, it is abstinence only. In contrast, New Hampshire requires comprehensive sex education. Their teen pregnancy rate is the lowest of any U.S. state, with 16 births per 1,000 girls. Currently, there's a bill, H.R. 3774, the Repealing Ineffective and Incomplete Abstinence-Only Program Funding Act of 2013. If passed, this bill will eliminate federal funding for abstinence-only education programs and reappropriate the funding toward a comprehensive sex education program entitled the Personal Responsibility Education Program, or PrEP. The PrEP program provides medically accurate information on abstinence and birth control for the prevention of pregnancy and promotes safe sex practices for the prevention of sexually transmitted diseases. This program also includes information on healthy relationships, adolescent development, financial literacy, education and career success, and life skills. This more comprehensive program would empower teens to make healthy decisions, and most importantly, unlike many abstinence-only programs, PrEP avoids using stigmatizing, shaming, and stereotypical definitions. Teens need more than just being told no in order to grow into adults who are responsible for their own health and family planning. A more comprehensive sex education program would empower teens to make healthy decisions for their present and future. Talk to your representative about H.R. 3774.